hold a public meeting on tonight.
No, I already read that. I'm sorry about that. This was muted for some reason.
Okay. It's my understanding that we were muted, and I'm being advised to read this again, so bear with me. So once again, this is to formally advise that as required by Mass General Laws, Chapter 30A, Sections 18 to 25, and pursuant to Chapter 20 of the Acts of 2021, an act relative to extending certain COVID-19 measures adopted during the state of emergency, signed into law on June 16th, 2021. The Yarmouth Board of Selectmen is holding a public meeting tonight, Tuesday, December 7th at 6 p.m. in the hearing room here at Yarmouth Town Hall on Route 28, South Yarmouth. The public is welcome to attend either in person or via alternative public access provided using Zoom, with the full Zoom details outlined and identified on our website. So having read that, once again, this is a meeting of the Yarmouth Board of Selectmen. Tonight is December 7th, and we once again want to welcome everybody, and we're now going to stand for a Pledge of Allegiance. Pledge allegiance
to the republic for which it stands,
one nation, under God, indivisible, with liberty and justice for all. Amen.
Okay, our first item of business is public comments. And I'm looking in the audience and I see Vita Morris. Ms. Morris, we're going to call you into the meeting and give you the floor. Okay, have we got her in? Ms. Morris, can you hear us? You're going to have to unmute yourself if you can.
Yes, finally.
There you go. We can hear you now. Please proceed.
She may be muted again.
Yeah, there's something going on with the mute button. Vita, can you hear us? Can you
She has to unmute it.
Can you unmute
Wait,
yourself?
now I unmuted myself, okay?
There you go. Now we can hear you. Please proceed.
Okay, okay. I just wanted to let you know that I thought last week's meeting was one of the most productive that we've had in a very long time, that I can remember anyway. And I felt that the presentation on the wastewater project was very comprehensive and very hopeful that things will seem to be getting on track, that this will now be handled and we be in our own hands, in other words, rather than being in a limbo with the other two towns. I just felt that also I was so impressed with Mr. Scott that I actually spoke with the town administrator, hoping that he could be the project manager, but I was told that I think his plate is a little too full. So, but in the interim, he will be, as I understand it, on top of this, and the liaison person probably with whomever we hire, I guess, from outside. So I wish him luck, and I think he's going to do a very good job for our town. That's my hope anyway. That to be very perfectly happy. I can't wait to hear that we have finally disengaged with the consultant that we have right now. I understand it hasn't been finalized, but I hope that will happen. Now to the other subject, the airport presentation was, I thought, also very well done. And I wonder if it may have had anything to do with Mr. Wolf's sudden resignation from the post of the CEO, I guess, of Cape Air. And in a certain sense, I hope so, because he just wouldn't have wanted, I think, to come and speak before, let's say, this board or, so I was very pleased with both of them, and I just wanted you to know about that. And I just have a question, would the public be able to participate after with the health board item on the agenda?
We will allow that, yes.
Yeah, thank you. That's it.
Thank you. Next to speak during public comments, I see Mr. Joe Glenn. Let's see if we can bring Mr. Glenn into the meeting and recognize him. Mr. Glenn, are you here? Can you unmute?
Hi, Mr. Chairman. Can you hear me?
Yes, we can. Proceed.
Thank you, Mr. Chairman. Joe Glynn from Precinct 6. First, on a positive note, and I want to echo what the previous speaker had said about last meeting. On a positive note also, I wanted to lend my support, and I know there's going to be an update from Chief Simonian, and I don't know to what extent that update is, but I wanted to lend my support for the fire prop, what we used to call in the fire service a burn building, but is more appropriately called a prop term. And I want you to know that the State Fire Marshal Cohen is a legend in the fire service, and one of the many reasons Massachusetts is a leader in the fire service. So the fact that he was there in support for people who are in the know of the fire service, his many years of service as a state fire marshal should not go unnoticed. On a more concerning note, and there's other matters that are in the works, so I won't talk about them specifically, but I wanted the board to know in regards to what I believe was an illegal mailing by the Water Resource Advisory Committee. On top of the concerns about who knew when, what, when, and why, but who authorized the mailing? I don't believe, and I've seen nothing as of yet, that the selectmen was advised of this. And I don't know if the Water Resource Advisory Committee was so charged to be able to authorize any monies. And this is in the tens of thousands of dollars. And because there was several mailings and man hours and town man hours, I would just like this to be addressed separately from what is, I believe, to be an ethics violation, and there's a complaint already being addressed there. But I just wanted the board to look into it. But one of the other concerns is voter disenfranchisement, that these mailings went out, and if you recall, the voters in one of our elections they were disenfranchised by the thousands. And one of the reasons was because we didn't have money to pay for envelopes and postage and other things. And people didn't get their mailings, including me, who was on the ballot. So my concern is that one of the things that I've seen happen is that we're sending out things to property owners, many times non-resident property owners, not town meeting voters, not registered voters. We're sending them to business owners who may or may not be in town. And this mailing times two, or so these mailings did not go to people who are residents, but may not own property. And as we know, we spent money on the health department doing inspections of homes. And I recall that it's over 5,000 different units. And if there's just one voter in those units, and if it could be a family of three with two adults and an 18-year-old student, they could be voters, and they're not getting information that's vital to the town, on top of the fact that this was a one-sided mailing, and so those people weren't getting it. to get any information. They should have been getting both sides of the information, but these people weren't getting it. So these are major concerns about voter disenfranchisement and the possible malfeasance of money. So I want the selectmen to look into this. I think that there was an overreach in your committee. The board was not advised. So anyway, thank you very much. I hope that you look into this all and have a great evening.
Thank you. Is there anybody else that seeks recognition? Yes. Here in the audience.
Thank you, Joyce Flynn. I'm here tonight as a volunteer from Solarize Yarmouth to invite you all to a session on Thursday night at the Senior Center, 6:30 to 8 with pizza. Both installers will be there, the solar installers from Solar Wolf Energy and also the installer Wayne Enos from Cape Cod, from South Shore Climate Control, who's doing the air source heat pumps. We'll have FAQs to pass out. We'll also have a chance for question and answers for people who have their systems under contract and have follow-up questions of the installers. We are finding that the installations are running slower than we thought. The kind of speed we used to call glacial speed before global warming, but we have to find a new adjective. But they're going slowly, so don't be concerned if yours seems beyond your mental timetable. I'd just like to assure everybody that in terms of the federal tax incentive, the 22% credit for the installed amount of the solar system will be the same in tax year 2022 as it was in 2021. So you'll be able to use it even then. We're also going to be concluding our Solarize program on March 31st, 2022. It is only a one-year program. So if you do want to sign up for the group discount on heat pumps, on solar panels, or on batteries, that's your timetable. So we're not having many holiday parties this year, but this could feel like one if you wanted to come. And the Senior Center is letting us have the ballroom. So if someone feels like dancing, I suppose that even would be possible. Anyway, if we don't see you Thursday night, have a wonderful holiday season, everybody.
Thank you, Joyce. Anybody else seeking recognition? I'm looking online. I don't see anybody in the audience online, nor do I see anybody here. So let's move on to the next item on tonight's agenda, and that is a COVID-19 update from our health department, Mr. Murphy. And also joining in should be the chair of the,
He's there.
he's there. Okay, but we need to move him into the meeting. So I'm going to just ask the staff to move Mr. Bosky, Dr. Bosky into the meeting.
Mr. Weston as well.
Okay, and Mary Craig. Is there anybody else I'm missing? Bruce, can you tell me? Is there anybody else of the attendees that needs? Mary Craig needs to be moved in. Okay,
correct.
Very good. All right, the floor is yours.
Thank you. Good evening, Board of Selectmen. Bruce Murphy, Director of Health. We also have board members, as you mentioned, present. The chairman's present, Hillard Bosky is present, with board members Mary Craig and Eric Weston are available at the meeting tonight. Okay, Board of Health mission. I thought I would put that in just as we had a meeting last night and just went over their mission statement, is protecting the health and environment of the residents of the town through enforcement of state and local regulations, administering health and safety programs, and proactive planning of regulations and preventive programs. Updated chart through daily cases through December 5th, which would have been Sunday. We can see from when the first wave became of the coronavirus within town, March 11th, the first wave Then we went to the second wave last November, December, third wave in the spring, and then the fourth wave Delta started in July. And you can see that it's continuing pretty steady and increasing. First wave kind of was new to the, obviously the country and everybody, and then kind of tailed off during the summer. Then we had the waves right after last Thanksgiving and Christmas. Weren't as long as what we're lasting as long as we're seeing the Delta right now. That's really spread out since July, and we can see it continuing increasing where we're hitting 110 cases. That's daily numbers. And then they drop off afterwards. So I think that's important to see where we're at. COVID cases of after Sunday, there was 111 active daily cases within town. November, for the full month of November, I think I gave you an update last time here, but this concludes the data for the full month of 246 cases. Pretty much kind of split 50-50 from people that were vaccinated and not vaccinated. Just breaking that down into age group, people that were positive from not vaccinated, 130, about 53%. You can see the ages right here. The highest is in that age group of 20 through 49, say 50, that have been positive that were not vaccinated. What we did is we kind of broke this chart out in half because I think it might be hard to see at home. So we wanted to just break out the first part, the positive non-vaccinated, the 130, so you can hopefully see a little bit better at home and see what the breakdown is. Again, at the non-vaccinated age group between 20 to right here, 50, that were positive. The overall age of cases ranged from 1 to 98 years old. The positive cases from vaccinated people are what you hear is the breakthrough cases. People getting, even though they've been fully vaccinated, the cases are a lot milder. They're not ending up in the hospital. So you have that number here. And again, the breakthrough cases are in that age group 30 through 74 that we're seeing right now. Yarmouth, looking at all the Cape Towns positive case percentage and the number of positive cases over the last 2 weeks. This data came out last Friday, comes out Fridays from DPH. We can see Yarmouth was a positivity rating of 7.33. A couple other towns have increased their positivity rate. Orleans, Dennis, Sandwich, and Barnstable ahead of us in positivity. Barnstable with almost 300 daily positive cases, which you would expect they're twice our town size. So we've got 149, but you can see Sandwich with 139 at a high positivity, and Dennis with an 8.3 positivity. So we broke that with a state average of 3.6. So we broke that out so we could probably see it a little bit better at home. Also, the top 6, as we went down through the chart, Yarmouth is at the 7.33 positivity rate, and that's based on 2,034 tests of 149 people. So that's the higher, it's above the state average of 3.6, almost double, and even higher above the county average. The remaining Cape Towns positivity rates are still above, a majority of them above the county average, and pretty much all of them above the state average, except Provincetown and Wellfleet. Positivity rate just for Yarmouth alone over the last several weeks. You can see from October, end of October, it's been going up. Positivity rate over the number of tests. The number of tests have ranged pretty much close to 2,000, and that's people getting testing through the testing sites, private sites at the hospital and at the county sites. So you can see Yarmouth is increasing in positivity and also increasing in the number of cases that we're seeing over that period of time. Fully vaccinated, we move into Yarmouth has 17,000, almost 700 people vaccinated out of the 24,000. We're at 73% within Yarmouth. And we can see quite a few towns ahead in testing for fully vaccinated. We broke that out to see it a little bit better. Also, the towns that have the higher vaccination rates. So we go down to where we are here, but it was interesting that you have Dennis with a high vaccination rate of 80, but they also had a high positivity rate. So I think that could be seeing some breakthrough cases there. We can see where Yarmouth is right here at the 73%. So we have not, Yarmouth has not moved up much in the last 3 weeks in the number of people being fully vaccinated. Then we still have 4 towns below us that are still working on their vaccination rates, working with the county clinics and local pharmacies. Yes.
2 slides.
Yeah, we took this one slide right here of all 15 towns.
Provincetown has more people vaccinated than total population.
Yes, which is interesting because a lot of people just put at one time they had a vaccination percent of like 105 because people were just listing that as their address.
Okay, I just thought I saw it wrong, but.
No, that's a great point. That's a great point. Oop. All right. Vaccination rate, as we break out the town's vaccination rate by age group, which I think is important as we follow. This is the first week that we've had it, that our presentation that we're including data from the age 5 to 11-year-olds that received their second shot are now considered fully vaccinated. So it's only 14, but that's pecking away at over 1,000 in that area. The next age group, 12 to 15, then you have 16 through 19. We only picked up 4 students there, but we have about 586 that are fully vaccinated at 76%. Probably of our high school age students are vaccinated. We drop off maybe into the college years of 20 through 29. We've only picked up 4, but that's only at 60%. So the high school students are doing real well to get vaccinated. Then we drop down to our next higher groups. You can see we have very good vaccination rates in the age 70 and above. Even we're in the 80s at 50 through 64 and 65 through 74. So we only had last week 77 new people get vaccinated for our total town percent of 73. This data comes out every Friday from the Department of Public Health that we put together. Hospitalizations from December have gone up to 21 people at Cape Cod Hospital and 2 in ICU. I think when I was here on the week before, we'd used the 29th. So hospitalizations are increasing. I do not have the status of whether they're vaccinated in general, because this is all Cape towns. Yarmouth hospitalizations, we have a little bit more data on. Just for the full month of November, there was 11 people in the hospital. And that was pretty much vaccinated and unvaccinated was close to 50%. 50% male, female, but several of them did have underlying conditions. So it's really hard to go back into the data. So you just look at how many had to go to the hospital. As we start off in December, we've already had 3 people that have been to the hospital with COVID issues. Vaccination clinics, this is a question Selectman Smith brought up last week along with the chairman, that the county health department does offer regular vaccination clinics. This is the phone number for it. And right now it's Thursdays at the County Complex on 6A. You can call for an appointment, which basically just tells you to go to self-schedule at barnstablecounty.org. So you can just go right there. They are full for this week and next week. The next opening they have is the 30th, and that's starting to fill up. So they do about 400 vaccinations of adults and children. So hopefully that's something the county will be able to expand more, because they're filling right up quick. I think people, when they go looking for what, and they're doing, the county's doing children, adults, as noted, in boosters. And as you look forward yourself to go to any of the local pharmacies, you're finding that they're waiting also, that it takes a while to get in. So I don't know if it's the vaccine, it's just slow getting here. And some of the pharmacies can't keep up with it, besides all the prescriptions that they're doing. So that's the county information, and you can get it by calling that number or getting on their website. And that website will also lead them to, if they need testing. Testing information is also on that barnstablecounty.org. So there's different test sites going on besides at the county, Orleans, and the county fairgrounds. So if you're looking for testing, you can go to that site also. So at this time, last night, the Board of Health talked about a mask advisory for indoors. And at this time, I will turn it over for further discussion from Board of Health Chairman Hilary Bosky.
Thank you. Dr. Bosky.
Yeah, good evening. There was a lengthy discussion last night about an advisory that was written, really directed at recommendations for wearing masks indoors in public spaces. And it's really very similar to what we issued back in August, but much more detailed. And in a very formal way. Is it possible the public can see the advisory at this point, or I can read it for people, or people on the phone calling in?
We have a full advisory. I did not post it in there. I do have the highlights of it though, Mr. Chairman, that we talked about, what's included in the advisory.
Oh, great.
I don't know if you want to go from there.
There you go.
Yeah, this is essentially, there's a list of some of the venues that would be considered indoor public areas. And those would be areas where the recommendation is to wear a mask, and that would be one that would be covering mouth and nose. There's also some mention just maintaining some social distancing. We all know about it. It's a 6 feet distance was mentioned in it. Some of the other highlights. Public transportation was a major one here. And there was an emphasis on that discussion. Certainly a mention of the fact that someone's vaccinated really doesn't change what our advice is in the sense of wearing a mask. As we all know, that people who are vaccinated still get infected. And wearing a mask really protects other people. And that basically this virus is spread by people who are exhaling, breathing out, and people near them are breathing in. And that's how this virus is spreading. And we all need to know there are people out there who are quite vulnerable to the virus more than others. Certainly in our population, it's a senior population, and over the course of our life, we all accumulate different medical problems. So there's a good percentage of people who are immunocompromised in our town. That's based upon age, people with diabetes, people who are on chemotherapy, people who have had transplants, people who are immunocompromised, based upon the kind of medications they're taking. So it's really the emphasis is on protecting each other. And that was really the emphasis of the discussion last night. It's, as I worded it, it's really an inconvenience to wear a mask. And I don't see it as more than that. There was some discussion about, is this a problem for businesses in town? I think that people are going to feel safer going into a restaurant wearing and if people are wearing a mask until they sit down, I think the people in the restaurant are going to feel more comfortable. And certainly people who are immunocompromised will feel more comfortable coming into our businesses. A vote was taken, and it was a unanimous vote in favor of this advisory recommending the wearing of masks indoors in public spaces. So that's sort of a summary of it. And that went into effect this morning at 12:01.
The other point, Mr. Chairman, is I think the board had mentioned that the board continues to watch the COVID data, and should the positivity rate go below 5% or the vaccination rate go above 80%, the board would look at the advisory again, and whether that needs to come down and be released, or if it continues, everything goes up, the board would have to look at other potential precautions that need to be taken.
Right. I mean, cases are spiking in the state, the county, and certainly here on the Cape. And that's what's happening here in Yarmouth. It's sort of upsetting that we haven't seen any budge in the number of fully vaccinated people. That has really plateaued. Combine that with some waning of the effectiveness of the immunizations is also adding to the problem. Hospitalizations are going up. And that's really some of the reasons why we voted in favor of this. It's really going to take a community effort here. We need to be saving each other. This really right now is due to the Delta variant. We haven't really seen a new variant, the Omicron, that is coming. It's in Massachusetts. And I would hope that your board will support us in our efforts. I know 2 weeks ago there was some discussion among yourselves of whether to support the Board of Health in our efforts here. And I certainly welcome any comments or that may help and have you have further discussions and support us in our efforts. It's all about the health of people living in our town.
Very good. Is there anything else that you'd like to add, Bruce?
No.
You said, okay, let's go to questions. I'm going to start at this end of the table with Selectman Horgan.
Thank you, Mr. Chairman. Bruce, the number 73% stagnant, it's been that way for a bit. Do we have any idea, other than the kids, is there any other population base that's making that up?
Making up for?
Are we able to identify who that 27% is made up of, other than the kids that aren't?
Yeah, I think we can look at it, that slide that showed the breakdown of the vaccination status that we had in town. I guess let me.
Certainly, it was the 20 to 49-year-old group, I think, it's really have the lowest percentage of vaccination right now.
Right.
Yeah.
So if you look at, we have about 2,500 residents within that 20 to 29, but yet only 1,500 have been vaccinated. So I mean, that's a big area that we're trying to educate more. And I think the question last time is, why are some people don't want to get vaccinated? And we're finding some people don't want to be told. We're finding some people think there might be concerns or reactions from it. So there's a lot of concerns out there and some misconceptions out there. We do have, would like to post up on our website questions about vaccinations, I think would be helpful. But we're starting to see maybe a little bit more edge towards vaccination with a new variant coming. I think people are saying, that's edging a few people on. But that's the basic big age groups that we need to educate.
How are we doing in schools and nursing homes?
Nursing homes are doing fine when we touch base with them. We haven't heard any outbreaks and cases there. The schools, and I had mentioned we did elementary schools at Mattakees and did about 150 students and their parents. So that is just starting it out. Bass River Pediatrics doing it on Saturdays for their patients anyway, so that's helping. And we did have McDonald's last week, partnership with McDonald's, and we had 3 young children come forward. So we'll probably work with, we're hoping for 30, but we're trying to work with McDonald's again. They're really willing to be a site and provide happy meals for the children going forward. So we're trying to continue that relationship.
Okay. That's all. Thank you to the members of the Board of Health and to you as well, Bruce, and your staff. Thank you, Mr. Chairman.
Thank you. Selectman Stone.
Thank you. I think it's a good idea, Bruce, with what you just said about posting like frequently asked questions and answers about the COVID, because there is a lot of misinformation. We know why a lot of people, or a lot of the reasons why people won't get vaccinated, and some of them it's a question of liberty. They feel that the state and its political subdivisions are trying to force them to do something. That's a problem with certain groups. But I think also there's an oversimplification of reasoning that's responsible. And let me tell you what I mean by that. When you look at the initial vaccines that were created against COVID-19, then we had all these variants, and people are saying, well, the vaccines don't work because an equal number of people now who are not vaccinated are getting the illness just like people who were vaccinating. Therefore, the vaccination is ineffective. Now, we know that's simplistic and illogical reasoning, because the vaccine that was initially developed was for the initial strain of COVID-19, not for all these variants. And these variants, it's like the flu shot every year. The scientists kind of guess what they think is the most likely strain of the flu to arrive, and they develop the vaccines based upon that. So it's really comparing apples and oranges. And I think that fallacious comparison has got to be dispelled, because we're talking about totally different things. The initial vaccine, even though it reduces the risk of death or serious hospitalization, that vaccine was to counter an identifiable genetic code that manifested itself in the first strains of the virus, not these other subsequent strains that scientists are still trying to unravel and find out what those codes are and what's the most effective way of dealing with them. For now, we're dealing with them with the old vaccine, so to speak. We haven't caught up to develop vaccines that are specific to target these mutations. And I think people have got to come to understand that. Dr. Bosky, you want to comment on that?
Well, the vaccines that we've been using have been effective, been very effective with the common variants that we've seen here. And certainly including the Delta virus variant. The mutations will continue to happen before we start to see the mutations and those versions of the virus arrive here. the rate of vaccinations did level off. So I think that's only part of the reason why people are choosing perhaps not to get vaccinated. I think we need to keep in mind, this is in the news every night. This is the Cape Cod Times, the Globe every day. I don't think this is new information. You're perfectly right. For influenza, yes, they're customized the vaccine every year. And eventually that may be the case here with COVID-19. That may be what's coming. But the vaccines are effective.
Thank you. Selectman Post.
Good evening, thank you. Mike had a lot of really good points there. And I think that that's one of the issues that from the people that are hesitant that I've spoken to. Yeah, I guess the terminology vaccine is what's the sticking point, because in fact, it almost is like a flu shot that's going to have to continuously keep up with these variants. So, I really wish they'd do a better job of educating people of the actual side effects. At this point in time, we should have some really good data as far as the safety of these. And I feel like we're missing out on that point because, obviously we want people to get vaccinated. So perhaps they're not talking about it as much, but I really think that the news has to do a better job of really talking about real statistics related to side effects to these, because I feel like they're fairly minimal, but yet it just isn't really spoke of. I was always surprised when Staples was laminating the cards for free, because I just got my booster. I didn't laminate my card. People are going to be carrying around multiple cards, because I think that it is something that we're going to have to continuously keep up on. One of the questions I had, I watched your meeting last night, and and I want to say to Dr. Bosky, my comments. Obviously, I think public safety is extremely important. My comments at the previous meeting was just kind of about the arbitrary nature of picking out a meeting room. I walked into the last meeting, we walked down the hall together, no masks, all of us talking, but when we open the door, we have to put our masks on, which I'm completely fine with, but it just doesn't make any sense because we're no less safer in the hallway. So it's rules like that just boggle my mind sometimes. But in relation to the advisory that you gave, you mentioned the state of emergency or the order that was allowed. So I was just curious, and I know we went through this years ago, and just not that I have a problem with what the advisory was, but just in terms of procedure, because we had went through this before, and you had said you had asked for support, but I thought it was originally based on a state of emergency from the governor that the authority was, and that authority was supposed to be something that was worked on together between both of the boards. So that was another part of my comment when we come in after the fact. So I guess the authority that you're operating under, and really what that process looks like is what my comment was before, and it is now. So I'd be interested in hearing your response to that. Thank you.
I think there's been plenty of opportunity for the Board of Selectmen to support the Board of Health. We've reached out. I've reached out on an individual basis to members to try to encourage a group effort here. That should be our goal, and it has been. So that's why I'm reaching out for support once again. Things are worsening here. With the windows going down, temperature going down, holidays coming up, with a new variant coming, things are going to get worse. And so we're looking for support. And I think it's fairly simple. I'm not sure I answered your question. If not, maybe you could try to ask it in a different way.
Anything else, Selectman Poster?
No, I mean,
Okay.
I would like an answer to the question. I understand what he's trying to accomplish. There's no doubt. I get it. But perhaps, Mark, you understood what I was asking in terms of the process and what,
Well, let me make an observation. I think it would be helpful for if the Board of Health is tonight asking us to take some action, whether it's to endorse or take other steps. I think it's in all due fairness, what we try to do is at least post those items. I think the board should talk about when we can get it on our next agenda. And then rather than take up these things sort of on the spur, I tend to sort of discourage that. That doesn't take away from the seriousness of it, but I think in fairness to all the board members, I think we should take this item, post it on an upcoming agenda so that the public has an awareness of it and has the opportunity to comment. I think that's very, very important. And again, I don't want to take away from the seriousness of things, but I think that's procedurally, that is what I'd recommend to the board, is that we take up this recommendation, have it posted on our agenda. All we have today is an update. So I would put it literally, whatever the recommendations are that we're being asked to endorse, at least get them on the agenda, put them there so we can have a chance to inform the public and discuss it and be prepared for the discussion. So I think that's how I'd like to proceed. Am I addressing your question?
yeah, to some extent. And I appreciate that because, but I guess my question was, back to the part about which piece of the authority is it? And the last I knew, it was supposed to be a joint decision. And I'm not sure how other towns handle that. I don't know how they work together, if it happens simultaneously, after the fact, perhaps one of the other board members.
Selectman Stone to comment on your question.
Thank you. I think there's two areas here where the Board of Health acts, one of which intersects with the Board of Selectmen, and one I think is within the purview of the Board of Health. The part that intersects with the Selectmen is the Selectmen are the shepherds, if you will, of public lands. And in that part of the statute, it talks about the health powers to the Board of Health, but it also talks about them working cooperatively with the Board of Selectmen, because they have jurisdiction over public lands. And I'm talking basically outdoor facilities like beaches, parks, and things like that. But aside from that, my understanding of the law is that the Board of Health has the inherent authority to pass regulations in furtherance of public health and safety. And if I understand what Dr. Bosky's saying, he's saying notwithstanding the fact that they have that inherent authority for purposes of reaching the public, he would like the Board of Selectmen to join in and endorse these measures so that the citizens and visitors and people that come to Yarmouth know that we're acting together in furtherance of public health. And I agree with Chairman Forrest that I think it would be more effective to have that as an agenda item and be discussed publicly so that you not only get support from the board, but the public too. But just for the record, I will state individually now that I do support these measures.
Does that help?
Thank you, Mike. Yes, no, it does, because I was trying to recall the dual, not dual, but the two board
Yeah,
situation that we had in the past. So I appreciate that. And I look forward to being on our next agenda.
Okay, thank you.
Thank you.
Also a town council opinion, I believe, on this subject, and we might want to dig that up and have it in a briefing packet. Thank you, Selectman Post. Selectman Smith.
A couple of members of the public have asked about natural immunity and getting vaccinated, and maybe that could be part of your Q&As on what natural immunity is and whether it's good, bad, or indifferent. Also, the governor is talking to a number of other states about vaccine passports. Is that something that you have discussed? And if it were to come to pass, would you be supportive of that?
Well, I'll take that question on the passports. That would be a state, something they would look at. I don't think you'd see any town doing that individually. That would be a state addressing through Department of Public Health or the governor's office.
Right. No, I understand it would be, up to the governor and some other states and stuff. But my question is, would the local Board of Health support an issue like that?
I guess we'd
If it
have
were
to
to come
see,
to pass.
we'd have to see what's included in it. I'm sure if it's for public health, the board would considerably, look at that. For the vaccination, that question came up at the Board of Health last night on people that have already been, have had COVID. Do you want to touch base with that again, Mr. Chairman?
Yeah, I mean, the science is there for people who have become infected prior to a vaccination. You certainly develop antibodies, but it's been found that if you go ahead and get vaccinated after you've been infected, yes, your antibody levels go up and you have more protection for the future. So I would encourage everyone, even if they've been infected and have not been vaccinated, to go ahead and get vaccinated.
Thank you very much. I very much appreciate the statistics. I read them whenever they come out and ponder them. And my opinion is, please get vaccinated.
Thank you. Thank you.
Very good. Anybody else? Okay, well, what I'd like to do is just to close the discussion is to just get a
Mark,
sense of the board.
you have somebody's hands up in the audience.
Have a public hearing, right?
Yeah, no, I understand. We're going to invite the public to speak. I'm going to ask, I'll suspend my comments. Thank you for raising that. I'm going to ask Vita Morris to be brought into the discussion so she can speak and ask a question or two. Can we do that? Can we bring her in?
The comment was they're trying.
Okay, they're working on it. Okay. I think we're getting close. We're getting warm.
Can
Morris?
you hear me now? I think I unmuted myself.
That's okay. We can hear you. You're on.
Okay. I'm just really exasperated by the Board of Health and their inability to use precise English terms when they're making these proposals. What is this? Is this a mandate or is this an advisory? I mean, there's a difference, I would think, between the two of them. Now, what just was asked about those who acquire immunity through having been ill with COVID. I already mentioned this before. There's a study from Israel that says those people who acquired the immunity that way, the immunity is 27 times more potent than from the vaccine. And then if you start mixing in the vaccine, I have a feeling that people will end up with having side effects and cause more problems than do any good at all. There's this other statistic that was cited today by Bruce, which says that the new cases break pretty much half and half. And the same thing holds for those who are hospitalized. So why is everybody pushing this vaccine on just everybody when these breakthrough cases are on the same level as those who are unvaccinated? It's just amazing. I think I would, first of all, as I said, I want, and as far as the new strain coming in, the poor doctor in South Africa who discovered it is very upset now because people are running with only the beginning of her statement, and that this new strain seems to be more contagious than the Delta one. But, and that's the most important thing, that it produces very mild symptoms. But everybody drops that and vaccinate again. It really is beyond. I mean, but first of all, and the silliest one of these statements that was under this advisory or whatever is the restaurant one. You have to wear walking in the door, and then you can take it off when you sit down. What kind of nonsense is that?
I'm going to ask that
That's it.
we'll be bringing this topic up at our next meeting, so feel free to hang on to your questions till then. Mr. Glenn, can we bring Joe Glenn up into comment or provide a question? Again, we're going to bring this topic up again, but if you have a question, Mr. Glenn, go right ahead.
Hi, Mr. Chairman. Can you hear me?
Yes, we can.
So to answer both your last person and Mike and Tracy's comments, because this language and messaging is what we're all trying to get to the bottom of. The Board of Health's trying to figure out why people aren't getting vaccinated. Some of us are concerned about whether this is an advisory or a mandate. Tracy and Mike are talking about the logistics of the authority, and I think enforcement comes to this. And so when we're talking about restaurants and we're talking about changing an advisory, we're sending a message out to the public, and then that includes tourists, of course, and this is a year-round tourist industry, and we're sending a message to restaurants, and there has been no, and this is the science, this is from the Board of Health, this is from Director Murphy himself yesterday in the meeting. There has been no clusters from restaurants or businesses. There have been in private settings. Okay, so we're sending a message about something where there isn't a problem, and it sends out a bigger message about our businesses, and other towns don't do it. These people, if there's a mandate, and that's the next step. So even if you go to advisory, which there were confusing wording on it, and we said that it's an advisory mandate, and then it says a requirement. Well, when you use those words together, it sends a wrong message that that's what we're going to try to do, an enforcement.
Joe, we got your question. Let me give Dr. Bosky a chance to respond. Okay. Dr. Bosky.
You're muted.
Yeah, it's not going now. It's off. Great. Yes, this is clearly an advisory, and if there's some language issues, certainly that it's been confusing, then we apologize if that's been the case. But certainly, I'd be happy to address those and Director Murphy. I think if that can be cleared up, certainly we'll take your suggestions. But this is an advisory; it's not a mandate. And there are plenty of good questions just raised, and perhaps at the next meeting I can address them. I'd be happy to.
That'd be great. That would be
Mark, just one more thing, because I want these statistics, which we're all using, and we're calling it science. So let me get it straight. We're telling people that getting the vaccine reduces the chance of hospitalization or death. And we're saying that if you get the vaccine, you have a lesser chance of getting the COVID. But yet Dennis has a higher vaccination rate, but they're testing, their positivity rate is higher. We have 11 people in the hospital, and Bruce said it was 50-50. Well, if there were 6 people who were vaccinated and 5 people that weren't, then the chances of hospitalization or death is not decreased by vaccination. It's exactly the opposite. So these are the questions we have to answer. I agree with all of you that that this should be brought out in public forum because we all want to make it clear, science is science, and we all want to make sure that everybody gets the proper information. Thanks very much. Thank you for talking about this.
All right, Mr. Glenn, thanks. Did you have a comment, Selectman Stone? Go ahead.
I would have thought that most people knew what an advisory was as distinct from a mandate. I think it's pretty clear, but obviously not everybody is clear on that. But I think one thing I want to make clear is that when the Board of Health says they have an advisory, it doesn't mean they just kind of think it's a good idea and do with it what you will. They're saying these are measures that they believe will reduce the spread of a very contagious virus that can cause illness and under certain circumstances, death. And it's a serious preventative action that they're taking. And then they're leaving it up to people like us to support it and the public to abide by it, basically. So while it's an advisory, it's intended to be a way to cut back on these infection rates.
Correct.
Very, very good. Any other board members have any other final comments before we move on?
I just have, yeah, the one thing that stood from the way I understood it was the mandate in meeting rooms. So there's a mixture there. Am I correct? Is that a correct assessment? That there is still a mandate in the meeting rooms with the rest being advisory. So that's where maybe the message is getting a little bit confusing with the wording. They're both on one document.
That is correct. That is correct. There's still a mandate for town buildings, meeting rooms to wear a mask. They're a lot tighter space-wise. People cannot social distance 6 feet in some of the small, especially the small conference rooms, or even this large conference room when you have a large meeting, people cannot social distance. So again, the board's taking stepped measures right now as advisory, across the town, but mandate in small meeting rooms.
And part of that is town hall. This is the town's government, the people working for the town. This is at meetings. It can be seen on Zoom calls. And that's the reason why the mandate was as specific as it was to the meetings and committee meetings, board meetings, that the mandate was directed just to that.
Thank you. All right, I'm going to conclude our discussions this evening. We will see you at our next meeting. Once again, thank you, Dr. Bosky, members of the Board of Health, and Bruce, appreciate your being here tonight.
Next meeting, that will be for a vote. We'll put it on.
We're going to bring it up as a board, yes.
Okay, great.
Great, looking forward to it. Thank you.
Thank you. Okay, the next item on the agenda is Dennis Pond and Grays Beach recommendations for the next season. As the board may recall, not too long ago, we got an update on how things went, and there was some generally good news to report. However, there was a number of, for what I would describe, minor suggestions that were brought up, and I know Amy Howell and Jeff Colby and others have been looking into them and want to give us an update on where things stand. So, Jeff?
Yes, thank you, Mr. Chairman. Jeff Colby, Public Works Director. There were several items, as the chairman said, that we were following up on. We reconvened the staff team made up of myself and the police department representatives, natural resource director, as well as the recreation director and parks, DPW park staff, to review those public feedback and see what portions could be incorporated in a plan going forward. The first item, there is a memo in your packet, and I'll just cover that briefly for those that haven't seen that, or just to hit the highlights of that. There was a request for resident-only parking or some portion of that within what is a limited parking area for Grays Beach. And we did have extensive discussion about that amongst the staff about challenges with regard to patrolling, enforcing, kind of managing those spots during the day. And the general thought of the committee and the recommendation of the board is that it wouldn't be practical to set aside dedicated spaces for residents only. It's a first come, first served type of facility. The weekends certainly can be very busy there, but just managing that component of it would be very difficult. So, you know, do you then ticket people that are properly paying that are in a residence only spot? And, you know, it just gets very difficult to manage. So there was just a lot of concerns that were brought up about that and how that gets managed. So the recommendation would be not to dedicate specific spaces to residents at that location. The dogs was another discussion that came up during some of the public comment at that last meeting. The town rules and regulations are pretty clear that dogs on Grays Beach are not permitted April 1st to Labor Day. They must be leashed at all times and are not permitted on the public boardwalk. So what we need to do is clarify some of the signage. We'll have the signage in place for the next season or well before the next beach season that makes those rules very clear. So we know that we need to do consistent signage work. As far as enforcement, the general discussion amongst the team was to leave that up to Department of Natural Resources. And if there is an issue with a dog on the beach during that restricted time, we'll call the animal control officer and have them deal with that. And we won't look to have lifeguard staff or gate attendants or anyone else involved in that type of enforcement. So I think clarifying those roles and responsibilities was a helpful part of discussion, and that's our recommendation going forward. Pavilion Rental was another discussion that another point that came up. There was some question about continuing that through the summer season. As the board's aware, we discontinued that this past summer because of an expectation with people that rent the pavilion that there would be spaces available for them, and it wouldn't simply just be first come, first serve. And the discussion amongst the group was just that would be very difficult to reserve a number of spaces for pavilion rentals only. And so logistically, how we would make that happen, it was just unclear. And that would mean less spaces that would be available to the general public if we reserved them just for the pavilion. So we also went back and looked to see people within the park staff that were out there every day, kind of interacting with the people. Are there people that still use the pavilion? And it was documented there were some groups that still used it throughout this past summer, just not in a rental basis. So it's still available first come, first serve. And we know that there were some groups that took advantage of that. Sunday mornings was a good example of a group that came out regularly and used it. So we feel that could continue. And that's probably the best way to handle that type of use at the pavilion. The last item, at least for Grays Beach, was the boardwalk, parks, trails, parking. There was some concern, and I think there was several people that mentioned this at the last meeting about how do you, if you just want to use the trails, how do you have to pay for parking? How can that happen? How can I use just the boardwalk? If I want to walk out there for 20 minutes, I don't want to spend the day at the beach, do I have to pay? And we talked about that with the park supervisors and the supervisors that directly supervise the gate attendants. And for the end of this past summer season, what was happening on an informal basis was they were letting people park adjacent to the gate shack there and use the trails and walk out to the boardwalk for 20 minutes, 30 minutes at a time, as long as it was a manageable, smaller amount of time, kind of on an informal basis. And so that's a recommendation going forward, is not to reserve specific spots for use of the boardwalk or the trails, but to empower the gate attendants to allow that to happen on an informal basis where they can park either kind of in the dirt access adjacent to the new gate shack, or even in some of the unmarked spaces that are in that same vicinity, kind of on an informal basis. And that seemed to work towards the end of last summer. And we suggested that continue on an informal basis as parking is available. So those were the items that we took away from the comments that came in relative to Grays Beach. There was one additional item for Dennis Pond. It's on the backside of the memo, and that was with regards to a clearer permit or sticker or authorization with regards to parking there and the use of that. of Dennis Pond. And we've discussed a number of different ways to do that. And we feel it's definitely possible to either have a supplemental type of sticker that can be issued and added to the vehicle's window, or if that is not possible, some kind of hang tag. So we were comfortable as a group that we can put something together that we can more clearly identify that for this next upcoming season. One of the challenges, not to get into too much of the details, but the town uses City Hall systems for sticker fulfillment generally, and having a special component of that for Dennis Pond is a little problematic. So what we would do is a separate, maybe former way of doing stickers where you would write the license plate number on the sticker and kind of more manually issue that. So that's the direction we're trying to head at this point. It's a supply issue in ordering those stickers, but we feel strongly that that can be in place for the summer season. And if for some reason that doesn't happen, we actually do hang tags internally within town for some of the kayaks and access to boat ramps. And that's another possibility as well. So we feel we have a solution for the Dennis Pond and making that much clearer for authorized users versus just the letter that's been issued in recent years. So that's the summary of the feedback that we got and how we feel we can improve upon the process that happened this past summer. What I would ask is for the board's permission to continue that going forward. That's really what we'd like to get resolved so we can order stickers and we can prepare budgets and get those things ready for the next season.
That sounds good. I'm going to invite the board members to comment or ask questions, starting with Selectman Stone.
Just real quick, Jeff, Nick, do we have any idea how many stickers are issued to Dennis Pond? It can't be that many people, can it?
It's not too many. I think it depends on the season. We did get some numbers that indicated last year was about 100.
That many, huh?
And previous to that, it was a little bit less, closer to 80. So it does depend on the season and where people feel comfortable, but certainly last year was closer to 100.
I agree. It would be better, obviously, if you could avoid, the passing of the paper as you referred to it. I remember a time when people did that with beach stickers. They didn't affix them in a permanent type of way to the car, and they, just tape them, and then they take them off, and they would use them on another vehicle. So I think to avoid that, that would be a good thing. Yeah, I just wanted to clarify if I understand this correctly. So people cannot reserve the pavilion between Memorial Day and Labor Day, but they can use it.
Absolutely.
So the first person that gets there, if they have some kind of activity that they want to do there, that they don't have to get any permitting or any permissions or anything like that?
That's correct. They can just use it. They can still have a small group that gathers there without the rental agreement. Absolutely.
What do you define as a small group as opposed to a large one? I mean, if a large one shows up, might there be a problem?
Well, there is a restriction currently, and I forget what the number is. We do have an item coming up at a future board agenda for updating parks and beach rules and regulations. And we want to talk about the number of people involved in gatherings is one of the elements we want to talk with the board about. So that will be subject to some, future discussions as to what that number looks like. But I believe the number at Bass Hole is like 25 is what we typically have
So
been.
roughly, I'm not going to hold you to the exact number, up to 25, they could just use it informally. Over that, it might be a problem.
Correct.
Okay, thank you.
Thank you, Selectman Post.
No, I just want to say thank you. I know some of those were concerns of mine. I appreciate the fact that you went back and took another look at it, and I support the recommendations. Thank you very much.
Thank you. Selectman Smith.
I think all the things are good except for a little bit of vagary on the pavilion. If there's more than 25 people, and I've often seen more than 25 people there, I worry about a little bit of liability and stuff. So, that might need to be tweaked slightly. But the rest of it, I think is real good. And I'll still sneak down to Dennis Pond without my car and go there.
All right, very good. Selectman Horgan.
Thank you to you and your staff for putting this together and really, for all the work last year as well. Most of the feedback that I believe the board saw was extremely supportive and appreciative of the changes that were made last year.
Right.
There were a couple of people that were aggrieved by the changes, but I think the vast majority of what I saw were extremely supportive of the changes. And I'm glad that we're going to continue that. I'm curious, one of the comments that we got was that we diminished the use of Grays Beach significantly with these changes. Do you have any way of estimating whether or not the use of the beach and the facilities was comparable to past years, or was it affected by these changes in any way?
Well, in the past years with the parking up and down Center Street, I would say that there was increased use because of the additional vehicles that were there. We don't have any definitive measure of that. We didn't, count people, but I would suggest because of the reduced, more or less the traffic restrictions with the no parking, that certainly minimized the number of people that used that. Also, charging for something does inherently minimize the number of people versus a free facility. So I would say that just by observation, there was a reduction in the number of people. But again, that's a very small beach. It's really tight quarters down there. And I think this past year, a more appropriate number, we're able to use it at any given time.
Okay. One of the other things that we talked about last year was this crossing over. And I believe your staff at the last meeting mentioned that the number of people crossing over had diminished significantly, but that there were still people doing it. Policy-wise, is that something that the town should be looking at in terms of a public safety issue in terms of people actually crossing there and causing the need for rescues by our staff? I know there's some signage there. Would you recommend any changes or us looking at a stronger policy as far as crossing over?
I think continued education is probably the way to go there. Amy Howell, who was unable to be with us tonight, has really got a good handle on this issue since she supervises the lifeguards out there. And she is the one that last time mentioned there was a significant reduction in the number of crossings. I'm not sure if we'll be able to completely eliminate that, but I think the lifeguards continue to be proactive, and educating people is probably a good next step in the process.
Okay, thank you very much.
Okay, thank you. Is there a motion to endorse the recommendations prepared by Mr. Colby, the Deputy Chief, Lennon, the Recreation Director, Park Supervisor, and the DNR Director? Do we have a
I
motion?
make a motion to that effect.
Do we have a second?
Second.
Second.
And I'm sorry, I missed, was that?
Tracy.
Okay, thank you, Tracy. All right, then if there's no more discussion, is there any discussion, any questions? Hearing none, all those in favor say aye.
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 Opposed? Carries unanimously. I just want to thank, again, on behalf of the board, thank you, Jeff, Kevin, Amy, Dave, and Carl for all your help and staying on top of this.
Great,
Thank you.
Mr. Chairman, before he leaves, can I just make a brief comment? I wanted to say that I made it a point to sit in on the team meeting that discussed this because I wanted to learn more about the many issues that face Grays Beach down there.
Mhm.
And I want to tell you, we had the DPW at this session, the police department, recreation, the parks folks, DNR, multi-jurisdictional elements of the town government from diverse departments. And I just want to say, I was very impressed with the collaboration, the teamwork that took place, and more than that, the thoughtfulness that each one of these elements brought to the discussion. And I went away from that meeting with a really great feeling about the mutual respect that folks had for one another and that problem solving. And before we moved on, I just wanted to thank Jeff and the whole team. I mean, it was very noticeable, and I thank them for inviting me. So
Very good. Thank you. All right, let's move on to the next item on the agenda. I see we have our fire contingent, and we're going to invite everybody to come up front. to either sit at the table or at least come up to the front row in case you get called to say something. And it's good to see everybody. Are we waiting for a presentation, Mr. Rittenauer, or are we? We have something coming up on the screen?
Yes,
Okay, thanks.
just some updates from the prior meeting that we had, some questions that the board members had. We did some more homework and got some more answers for you.
And you're going to introduce the team, Chief?
Sure. I have Chief Burke directly behind me. He's the president of the Barnstable County Fire Chiefs Association. He's the Sandwich Fire Chief. He's also sent a letter in support of this, and you should have that copy of that in your packet.
Very good.
Retired Fire Marshal Steve Cohen is sitting directly next to him. And some of our mutual aid partners, Deputy Chief Greg Thornton from Harwich and Deputy Chief Tony Kent from Dennis, along with Deputy Chief Sawyer.
That's great. Thank you all for being here tonight. We appreciate your presence.
Okay, last time we met, the board had a few questions with regard to the operations of this. So we did a short PowerPoint with regard to maintenance, consumables, and operating costs. Next slide. In talking with the manufacturer of fire facilities, they define this prop as a very low maintenance prop, being a metal clad building. And they stated within the first 5 years, due to the construction of being all steel, very little will be needed to maintain this building initially. They recommended annual costs of $2,500 to $3,500 to maintain the building. But again, I reiterate, they said the first few years, very little is going to be needed to be done to this building. Simtech, which is the manufacturer of the 2 propane-fired burning props, they recommend an annual cost of $7,500 for maintenance and upkeep. Next slide. The fluid for the artificial smoke machine comes in a 55-gallon drum, which is the most cost efficient to purchase it. That will last about 1.5 to 2 years at a cost of $1,200. Propane will be based on the usage and how many burns that are done in the building. We did get a notification from the Propane Association that our first tank full will be donated by them. So we'll have zero cost initially to get started, which is a great thing that they're doing for us. And on water, as I said in the previous statement, there's very, very minimal water usage being used at this building because it's a propane fire. It's not like we were burning like in the old days. The Class A materials of wood and straw required a lot more water to extinguish. Okay, as far as the operating costs. So each user that does not provide their own site manager and igniter, they'll be responsible for paying a user fee to cover these operational costs. They'll be based on their individual collective bargaining of each of the site manager and ignition supervisors from their home department. So our plan is departments are going to train up personnel also to be site managers, so it won't be a burden on Yarmouth Fire Department. And I think that'd be a great thing going forward. But in the event a small department, say, does not have that qualified person, then we will have a core group of operators from Yarmouth and other departments that can serve that capacity. And that user will pay that fee. So there'll be no cost to the town of Yarmouth. And as I said, the home department will be responsible for the billing and paying of those members. We did a survey with all the departments on the Cape, and we had great results with regard to that when it came to the user fees. We surveyed, we had 19 responses. 18 out of 19 departments have chosen to use this prop and support it in theory and financially. So based on that, we looked at the potential of $1,000 a day fee charge for the use of the building. But based on the survey results, we had 10 departments are going to use it at least twice a year. 7 departments are going to use it at least 3 times or more a year. 1 department's going to use it once a year, and 1 department, which ended up being Nantucket, logistically said it was going to be too difficult for them to utilize it. So with that, if we charged a $500 a day user fee, we'd generate a little over $21,000. I believe it's $21,600. I believe that will more than cover the maintenance of this building based on its usage. So you're talking about, that's equates to 42 times someone would be using this building. And again, not all of it would be a burn. There might be a situation where a department will come and utilize it for throwing ladders, or maybe they're just going to do a search and rescue with no burn. So we thought of gauging our charges based on what the use is. So if they were going to do a full day with smoke, artificial smoke, and propane burns, that would probably be like the $500 amount. But if someone was just going to come and do a smaller scale use of the building, maybe we tailor that a little bit less. But I believe more than enough will cover the operation and the fees and the operating costs based on the user fees.
We could review, of course, each year we could review the fees. If we're running high, we don't have to ask for so much, and if we're running low, we can adjust it.
Mm-hmm.
Also, we have a sample MOU that was sent out in your packet as well. That came from the Yarmouth, Maine Fire Department. It's just a sample. It's not actually ours, but we're going to tailor ours for Yarmouth, Mass. But it was a good example to show you folks of how they do it. They've got a great system up in Maine, and we actually thought of the $1,000 a day. That's basically came from Yarmouth, Maine. That's what they charge their surrounding communities to operate their building. Okay. Anything else? The user manual. Yeah. You want to speak on the user manual?
I just say the materials we gave you was in response to the last meeting. So, of course, we have draft and sample written all over this. There was some confusion about the Maine. Somebody had tried to correct us on that, but we know it was from Maine.
We were actually talking about going up to Maine, and that's the confusion.
Okay.
So this with a draft, we have a great resource sitting behind us, and tremendous group when we all get together.
Mm-hmm.
And we put this stuff together. So everybody's on board with it. I think, Chief, this would probably close up the rest of the meeting right there.
Yeah, I mean, if you'd like, I could read the support letter from the Barnstable County Chiefs, or if you're okay.
Why don't you read it into the record? Go right
Okay,
ahead.
I'll do that. From the Barnstable County Chiefs Association. Dear Chairman Forrest, the Barnstable County Chiefs Association held its monthly meeting on December 1st, 2021. At that meeting, a unanimous vote was taken for the support of the proposed training prop on the grounds of Yarmouth Fire Department Station 3 in West Yarmouth. The training prop will provide critical fire training in suppression, technical rescue, as well as all hazards simulations to include active shooter. This training prop is especially important to our island partners who will now have an easier time coming to Yarmouth for training and not having to travel off Cape. The prop will also provide the lower Cape departments with a geographically centralized training that will make them compliant with NFPA standards for training. The Barnstable County Fire Chiefs and our island partners support the philosophy for the need for the fire training prop. Barnstable County and Island Fire Chiefs will pay for the use of the training prop with whatever user fee structure is implemented by the town of Yarmouth. The fee structure will include the cost to maintain the prop as well as its use. On behalf of the Barnstable County Fire Chiefs Association, we appreciate the town of Yarmouth being the host for this critical training resource and look forward to supporting and working with the town moving forward. Thank you for your time and consideration with this matter. And it's signed by Chief John Burke, Sandwich Fire Chief.
That's
who is
great.
sitting behind me.
Again, once again, we appreciate all your colleagues being here tonight. I'm just going to open it up to see if there was anything that they'd like to add. That you made the trip to come to Yarmouth. It's great to see you, but is there anything else that you would like to comment on or speak to? I see Chief Burke is ready to.
Chief? No, just on behalf of the chiefs, again, I want to reiterate how appreciative we are of the support for the prop and the need. And I think, we look at training, we're trying to be progressive and cost effective, and this does both. It's environmentally friendly, it's centrally located, and for especially our lower Cape partners, this is a perfect training opportunity for them to come down to Yarmouth instead of going off Cape. So we're in full support. And again, I appreciate the board and the town and their support for this prop. I just wanted to reiterate that.
Thank you. Anybody else?
I would, Mr. Chairman.
Yes.
Steve Cohen, the retired fire marshal. But I sit here tonight representing the county and have worked very closely with the chief and the deputy over the last couple of months. It's been a very rewarding process as they're so committed to this. And I would just say from my many years of being in the fire service and recognizing how the profession has changed, that we are so geared towards EMS. And EMS is really the main driver of most of the calls that these departments go on. And this type of a prop being made available to the departments will allow the firefighters to hone their skills and renew their efforts in actually facing live fire, the dangers of it and how to do it properly and how to bring those firefighters home safely because of the enhanced training that this prop will give. So it really is a great asset that will come forth for all the departments in the Cape. I'd also just like to add that the manager reached out today to the county administrator, and she responded back to me and is prepared upon hopefully an affirmative vote by the board to sit with the manager and initiate whatever documents are necessary to be able to transfer this prop upon its completion to the town of Yarmouth. So that would be the next step that we'd look forward to working with the town on. Thank you.
Very good.
Thanks. Craig Thornton from Harwich, Deputy Chief. I'm just here to support the chief and the deputy. They've done a great job with a deep dive in how much this facility is going to cost. And I assume that is a concern of how much it's going to cost for the taxpayers. And these guys have really done a great job because they don't want to put any burden on the taxpayers. And we realize that this is a huge need for us on the Cape to have some type of facility, but we also don't want to put the burden on the Yarmouth taxpayers. And I believe that the Barnstable County Fire Chiefs, along with Chief Simonian and Deputy Sawyer, has a great plan to move this forward.
Thank you.
As Deputy Chief Thornton said, Deputy Chief Tony Kent from Dennis Fire, and we're here to support these guys also. And it will be a great facility if it when it does get built. So we appreciate everything that you're doing.
Thank you very much. Thank you. Unless there's any other presentation to make, I'd like to ask the board members to ask questions or make comments. And I'm going to start with Tracy Post and then work my way around this way.
Great, thank you. And thank you, everybody, for the update. I have several questions. How many towns, Chief, did you say was interested in the usage? Because I heard you say Nantucket was out, but other than that.
So we did do a survey. We surveyed 19 departments. I don't have the exact departments that agreed to use it, but out of the 19 that replied to the survey, 18 said they wanted to use it. And based on that data, one department said they would use it at least once. 10 departments said they would use it at least twice. And 7 departments said they would use it at least 3 times or more.
Okay. I guess I'm thinking a little bit along, we've had, unfortunately, I've been through some tough budget cycles, and oftentimes, as you know, in some of these communities, sadly, extremely sadly, because safety, and as Mr. Cohen said, safety and making sure you go home should be our #1 priority. But sometimes the training budgets get cut. So had you considered a separate funding source, #1, meaning like a separate fund, so it's not mixed in with the general? And #2, what I think is important to separate the maintenance, insurance, the fees that the town of Yarmouth are going to have regardless of use. Maintenance fees separate from user fees, where everybody has an ownership. Because what I'm afraid that's going to happen is either the training budget gets cut or they decide to use a different facility. So I think we need to have some safeguard in there that secures a set amount of money that covers some of the costs that you talked about, regardless if it's used or not, and then have maybe a smaller user fee in addition.
Okay. We looked at that, Tracy, originally. We looked at a maintenance fee separate from a user fee, and we brought that before the Chiefs Association. And there was a deep discussion over that, but we felt that the user fee would more than cover the funding to maintain and operate this building. We also had a great meeting with Senator Sear with regard to the state earmark that comes from DFS. And that's looking very good to continue to, and a portion of that would also go to offset this building. So that's also a consideration for future funding.
Yeah, and that's great. I guess I'm just concerned that if, there's no users, the town of Yarmouth is going to end up holding the bag, so to speak. So there should be just some ownership in there to make sure whether it's used or not, that that it's getting covered by those that are eligible for its use. I'm pretty sure that's kind of how the county works, right? The county, everybody pays in and they get the use of the space. And then when you use it.
With regard, yeah, if I may, with regard to all the fire training we did with Barnstable County, the Barnstable County Fire Departments never paid a fee to use the old Barnstable Fire County training facility or the mobile props. That's been
right, but the towns themselves paid in to keeping that facility. The towns pay into the county itself,
yes,
which is what I'm saying. The towns aren't paying into this unless they use it.
I see. Yeah.
Yeah. So that's one of my concerns. The other thing is in the sample agreement that you have, it highlights and talks about under Title 51. Can you explain Title 51 to me?
Want to do that, Doug?
No. When Tracy, you had asked us to that you wanted to see the sample of the MOU we had, and that's the only one we had, so we wanted to make sure we got that to you. Going forward, what we would need would be legal advice and how to create our own. So that is simply just a sample, nothing that we've studied or read through or could advise on it without legal advice.
Well, that was my next question. If town council had reviewed this document, so I guess it's a little bit premature, but has there been any consideration to the separation of the funding? And maybe that's a question for the town administrator.
The money could not be separated from the general fund without special legislation.
Yeah, I think we're going to have to somehow find a way to, so I think it's only fair to the other towns, if we don't want it to be a cash cow and overcharge towns for something that's costing us a fraction of it. I mean, certainly it should cover the cost, but I think we should find a way to separate it so we can clearly demonstrate the expenses and the income. But generally, I'm extremely supportive of this. I think there's some small details that we need to work out, but I appreciate everything you've done. Thank you.
Thank you. Selectman Smith.
I have some of the same concerns that Selectman Post has on the income, and will there be drop off in future years? And it sounds like from the town administrator, we can't, if there's excess income coming in, it can't be held aside to cover those potential lean years.
What can be done is any of these revenues can be tracked and we can make financial reports. It just, everything has to stay within the general fund. So it wouldn't be a situation that you'd have a rolling balance that carries over every year. What we'd like to do is we'd like to isolate the expenditures within each fiscal year, and then we can operate it that way and provide detailed financial reporting that sequesters all of the funds and reports completely on them. It's just that there are certain rules that you have to maintain that involves separating it out, such as like, we do with enterprise funds or any special type of revenue.
Right. The other thing that I would suggest is, the town, you said 18 of the 19 folks that you discussed with were very much interested. Could you get a written commitment from them that they would be on the hook for at least 5 years?
We did not get that yet. That was just a survey that we did because we wanted to get a number and get a consensus of how many of the departments were interested in using us and how many times, so we could kind of tailor the user fee based on that.
No,
that's a good idea, actually.
Right.
Yes.
Yeah, if you could get them to commit and just at least a minimum amount, just so you know that you've got enough income coming in, for 3 to 5 years, and 5 years is better than 3. That would be my suggestion. I think it's a great prop. I think it's going to be excellent for the safety and in particular, as Tracy said, safety of the firemen and anybody who's happens to be trapped in a building. Absolutely. No other comments.
Thank you. Before I go to the next board member, I noticed that we have a representative from the Chatham Fire Department that's joined our meeting tonight, and I want to, they were seeking recognition earlier, so I'm going to call them into the meeting and see if we can get them to participate.
Hi, I don't know if you can hear me.
We can hear you. Yes, welcome. Just identify
Chief,
yourself.
Yeah, Chief DePasquale, Chatham Fire. I just want to jump on board here too with what the other chiefs and deputies have said. That we have a huge need on Cape Cod. We're all having trouble hiring good quality candidates. They don't have firefighter 1 and 2, and I think this is an avenue for us to achieve that. And I know that Chatham will commit to 5 years right now. I'm open for any questions.
I don't think we have any questions for you, but I really appreciate you joining the call and being here at this meeting. It's very, very helpful to have you here, so thank you.
Thank you.
All right. Selectman Horgan, do you have any comments, questions?
Yeah, thank you for the presentation. One of my concerns when we first talked was, would this put too much pressure on our overtime if all of our guys were doing the training? And I think you've addressed that by opening up the training for other departments. So I'm very, very pleased by that. And I just think it makes sense for them to take that responsibility on as well. I'm curious, will the town of Yarmouth be allocated a cost for when we use the facility?
I think initially we would pay our fair share to get the thing up and running and make sure we can support it. And that would be a discussion that I would have with the Chiefs Association going forward, because there was some discussion where the host community would not be charged the user fee, being the host community. And again, I would defer to my colleague chiefs, and if they voted in favor of that, then of course we would do that. But I think initially, if we all chip in to support this prop and get it up and running and make sure we can cover all the expenses, I think that was the goal.
Add something real quick, is that our day-to-day operation of a shift, going back there, throwing ladders for an hour or doing something small, we wouldn't be paying for all that. It would just be like our major training that we would do just like any other department would do.
Like what we used to do at the Barnstable. We were the biggest user of the old Barnstable Fire Academy. We'd go there 10 times a year with our members. We do 5 live burns in the spring and 5 live burns in the fall. So our whole department went there, and our on-call firefighters as well.
Okay. I too was a little concerned about the commitment in trying to put some kind of stability into that, or some expectation that we could count on. And 5 years is good. I was thinking 10. But, you know, I think that would make us all feel a little bit more comfortable if we could get that kind of buy-in from the towns. Other than that, you know, when this was first broached, I'm always a little suspicious of packages that are given free. And I wondered about, you know, are there hidden expenses and unintended consequences that were going to come from this? But you really seem to have put together a really nice package. And I think that the people of Yarmouth need to realize that this is a free building, a free training facility that's state of the art, to give our firefighters the training they need, but also to, you know, really be a host for the Cape. So I think it's a really wonderful opportunity, and it would be a mistake for us to pass on it. Sounds like you've tightened up an awful lot of the issues. If we could tighten up that commitment piece, and I can't think of anything else that I had questioned about, but you know, just being clear about the money, how it's handled, how the costs were allocated. But I'm supportive. I appreciate all the other fire chiefs coming to talk and to advocate for this project. And I hope we move forward.
Thank you.
Thank you. Selectman Stone.
Thank you. I have a specific question to start with, where it talks about the agency, which are the member towns. I understand that to be, pays Coastal Mutual Aid a fee. So who is Coastal Mutual Aid? What kind of an entity is Coastal Mutual Aid? Who runs Coastal Mutual Aid?
That's
How does
Yarmouth,
Coastal
Maine.
Mutual Aid handle those funds and account for those funds?
Okay, so that's the sample MOU, and that's Yarmouth, Maine. So they have Coastal Mutual Aid as their association. All the member departments pay into that in Yarmouth, Maine. That's the sample MOU. That's not Yarmouth Fire's MOU. Yarmouth Fire, Massachusetts, not to be confused with Yarmouth, Maine. So we provided that as a sample MOU. It doesn't mean we're going to do exactly the same thing as that, but that was a good sample to show the board of an MOU that's already in place with a very similar building to ours and the agreements with those surrounding departments. So that is something we're going to work off of and create our own.
Okay. All right. Because this agreement does need a lot of work. There's no question about that. And I don't mean that critically. There's just, I'm glad that you defined it as a sample.
It's a sample,
Otherwise,
it's
I'd be
not ours.
talking to you for quite a while about it.
Yeah, it's not ours, it's a sample, yes.
We'll accept some help with it.
Absolutely. We would appreciate
Send it
it.
in Word. Send it in Word so I can redline it, and I'd be glad to help you. But
That'd be great. Thank you.
You'll see a lot of red ink. Consistent with what I think the other selectmen are saying, and I'll say this in broad terms, I think there's a couple of questions here and a couple of caveats. First of all, it seems to me that Yarmouth should get some kind of benefit for hosting this, instead of, let's say they use it 1/10 of the time and Yarmouth pays 1/10 of the cost and we're all square. Well, so does everybody else, and they don't host it. It seems to me there should be some recognition of a benefit or a discount or something. Now, I understand, you know, to get this thing going, like you said, maybe everybody throws the same amount of money in the kitty, but going forward, I mean, if this was in Barnstable or this was in Chatham or this was in Harwich or Sandwich, I would expect the local people who were sponsoring this, so to speak, to get some kind of a benefit out of it. But moreover, and more importantly than that, I don't think Yarmouth, under any circumstances, with the way this thing's financially structured, should be subsidizing any other towns. Worst case scenario. I mean, I just want to make that clear where I'm coming from. Because why? Why would you do that? I mean, how would the Yarmouth residents benefit from that? And then I didn't think of this myself, but it was at Dan's comment about, you know, the number of years, you know, initially to buy in, to become a member of this training facility, or a shared partner, I guess, of this training facility. To make it viable, it seems to me that there should be some kind of minimum commitment. Because if somebody's in it for a year and they're out, and you get several defectors, so to speak, it could cost you a lot more than you think. So,
If I could respond to
and again,
that.
I don't have a specific number for you, like 3 years, 5 years, 10.
Right.
I'm not going there. I'm just talking conceptually at this point.
So I'm very comfortable based on the survey results. I'm also very comfortable on the past use of the old Barnstable Fire Facility, and we have that data as well. So between the two, I feel very confident that this building will be used by these departments that say they're going to use it, and they will pay the appropriate fee. If certain departments drop off and they can't go, we will adjust the fee accordingly to make sure that we can cover all of our costs.
Yeah.
But I think that's a good thing going forward.
All right, thank you. That's all I have, Mr. Chair.
That's very good. Thank you. Let's see, is there anybody else on the board? Selectmen? We've heard from just about everybody. Tracy?
No, I mean, I've heard the other board members, and I guess I'm back to, you know, when you take the annual costs and you divide it by the 18 towns, it's a little over $1,000 a year. I don't think that that's a huge commitment. Perhaps what needs to be fluctuated is the actual user fee, but the basic costs of the facility need to be, there needs to be a commitment for that to be covered regardless of use. That's my ultimate concern. And I heard what you say about the discussion that you had with the chiefs, but I think if they were sitting in our shoes, they'd be probably feeling the same way that we do. You know, I don't think $1,000 a year for each town's a lot, and you know, then you can use it at a very cheap rate. But at least we can guarantee at something like that our fees are covered. The structure that you have now, I'm concerned that it won't be covered. I know if you get the users that you anticipate, but you know, the other side of that is, I feel like we do have a benefit of hosting it. The availability of our firefighters to be so well trained with it right in our backyard is one benefit. You know, perhaps down the road, but I think getting this facility that we can use, where all the departments really don't have a facility that's accessible without a lot of travel and extreme probably overtime. So getting this off the ground is more important, I think, for us as a community, to make sure our firefighters are trained before we reap any type of financial benefit, so to speak. But having said that, I would not be comfortable going forward without some commitment from each of the member towns financially.
Okay, thank you, Selectman Post. I don't know if any of our guests tonight want to comment on any of this. You know, I'm looking particularly at you, Chief Burke. I know you're engaged. You've got a lot vested in this as well. I would be interested. Do we have anything to worry about in terms of on the cost side?
No, and I think some things have not been highlighted here. There are other revenue or cost grants that are out there that we're pursuing.
Okay.
I know of 4.
Okay.
But the select woman who just spoke, saying having something up front, I agree with that. You want to have some stabilization there, but also we're looking at long-term viability here with federal and state grants to supplement. That happens, nobody's paying anything, and everybody can use it as much as they need to, because we have this, and these facilities are what the grant on the federal and state level look for. Collaboration, public-private partnership. It checks all the boxes. The fact that the grant cycle hasn't come up yet, and we got to make a decision now, is the timing is not the best. But, you know, we were talking about 5-year commitments. I have 5 years left, if not more. We're committed. Not only do we have to do fire training, I have the largest power plant in southeastern Mass. We're required to do confined space rope training every year. I can come here and do it. If I have to pay $1,000, it's cheaper than, $2,500 that I'm paying now. So it's going to get used.
Yeah.
It's definitely going to get used, but we're going to exhaust all those grant revenue streams that are out there also.
No, I appreciate that. That's very helpful information. Well, I think generally you get a sense from the board that we're all very much excited about this. You've heard our questions. I think it's just a question of figuring out how we put the pieces together and then coming back to the board with the necessary agreements, going from a sample agreement or a model agreement and putting those together and tightening them up. I think that's the next stage for us as a board. And I look to the town administrator. Can you tell us what you envision as the next step for us?
That's correct. I think at this point, what we need to do are finalize the agreements that are associated with this. You've seen the sample agreement. We're also in discussions with the county, as Fire Marshal Cohn pointed out, to have the specific agreement for the permission for the construction, how that facility is going to be put in place and then transferred to the town. And I think our next step, we've got 4 or 5 issues that were brought up this evening, to put those together with the necessary agreements and come back before the board for a potential vote.
Sounds good.
Can I just make one more suggestion?
Go right ahead.
Only because, I don't want my comments to stand in the way of this moving forward. I mean, if there is in fact grants, I think that that's a great opportunity. And perhaps the verbiage in the agreement could reflect that if in fact these grants were received, that exceeded the amount of, exceeded the amount of an annual year's expenses or whatever, those fees would be waived. In that case, I think you could do it that way where, if those things come to fruition, then that's great. But if they don't, I think that we should have a backup plan. And I hope we do get the grants. But I think that we could structure an agreement in that manner.
That's great. Thank you. Well, I'm going to cut this off and end this. I think it's been a very productive discussion. You've answered a lot of the board's questions. And once again, it's great to get the presence of all our colleagues from around the Cape and you, Chief Burke, and all the work that you've done with the association. We really appreciate all your input, all your involvement, all your help. And obviously the former fire marshal, Mr. Cohn, you're an all-star. We appreciate your heavy hand being on this and helping bring it together. It's very, very important. I think, as everybody knows, Yarmouth has sort of a renewed commitment to the training of people who put their lives on the line for the community. And I think in that spirit, you will see the town of Yarmouth respond very positively as this facility comes forward. And we can't thank you enough for all your hard work on this. So thanks for being here, and good night.
Thank you.
Okay, the next item on our agenda is we'll put Selectman Smith on the spot. We have committee resignations and appointments. So the floor is yours.
First item is adding people to the golf committee. Doreen Levitin, should we do these individually or do them as a group?
I would recommend that we do them individually.
Okay.
So there's no question.
Right.
And if there is a question about an individual, we can just deal with it that way.
Ms. Levitin would be appointed for a 3-year term, which will run through April of 2024 as a full-time member.
Mr. Chairman, I move that we accept the appointment.
Second.
Can I be heard on that? I don't know this individual, and but I do, and we have received correspondence from Norm Holcomb, who applied for this position. And in that letter, he details his qualifications. Having served on this board and another board of selectmen in another state, and having been involved in golf courses both in that state and here. Experience as a finance committee member, a master's degree in accounting, CPA experience. I don't know why he wasn't appointed, to be honest with you. He says recently he's been vocal in opposing fee proposals that are not supported by well-articulated and publicly vetted financial information, and I happen to agree with him. The board did not support those increases for those reasons, among others, and he states that he believes his opposition and public stance has basically excluded him from appointment. And I mean, I hope we're not failing to appoint people we don't agree with, because that's really not the democratic process. I don't know the other candidate. I guess her background's in nursing, and she may be a very fine woman, and I don't mean to cast any aspersions on her because I don't know her, but I do know Mr. Holcomb. And in terms of the financial tasks before the Golf Enterprise Committee, I don't know where you get a more qualified person, and I don't know why he did not get the appointment.
Well, it's a recommendation. If I can just add a comment.
I don't know why he didn't get recommended.
I see.
Question of semantics, but I mean, I think, you know, I'd like to know that answer. Why? I mean, how when his credentials are so superior to the other candidate for a Golf Enterprise, why did he not get the recommendation? Because, is it true because he disagreed with one of their proposals? Or are we just doing this arbitrarily? I don't know. I'd like some answers on this one.
All right, Selectman Smith, do you want to offer any commentary?
Sure. One, the board has not turned down or fully discussed whether the rates will be increased at the golf committee or not. So that's an untrue statement by you, Mr. Stone.
No, it isn't. The board did not.
No, we have
The
not.
board
We have,
did not
Mr. Stone,
adopt-
do not interrupt me.
The board.
Do not interrupt me.
Come on, let Selectman Smith just
Why don't you
answer.
answer my question?
I think we should let him answer your question. Selectman Smith?
We interviewed a number of people, myself and the head of the golf committee, and we felt that Ms. Levitin was more qualified in many ways and shape and form over Mr. Holcomb. Mr. Holcomb did interview with us. He does have some good qualifications. We felt that we needed some new blood, and we felt that Ms. Levitin would be very well qualified. She's been a golfer for a number of years. She spoke very well and spoke very highly, and we think that she would have some very good ideas and qualifications to be part of the committee.
So again, I don't hear anything concrete.
Okay, well, is there anything else you want to add? So we're going to start with, the candidate is Doreen Levitin, and this would be for the regular member. I don't know who any of the other applicants are. So I'm just going with this information, other than the email that I received from Mr. Holcomb.
See, this is, can I say,
Go right ahead.
Yeah, I mean, it's difficult for us because we don't have, other than what's put in front of us, just so the public knows. I have no idea who was interviewed for this, so it's very, very difficult. And you know, I feel kind of bad for these particular people being pulled out, and I agree with Mike's assessment in terms of qualification. Certainly, he's qualified. And I don't think that that's anything negative against the two folks that were put before us. We happen to know Mr. Holcomb in that situation. But oftentimes when these recommendations come forward, we have no idea who else other than what's recommended in front of us even happened. So, you know, we've left some of this kind of up to the appointments chair in the past. And I understand oftentimes we look for new blood, but that's typically on somebody who is serving in multiple levels or on multiple boards, so we can bring new people in. But to my knowledge, Mr. Holcomb doesn't serve on anything at this point in time. You know, I hate to take both of these people individually, because if you look at, I mean, we're talking about one recommendation now, but ultimately the same argument could be made for both of the candidates in terms of their experience. And again, it's hard to have this conversation because these people are volunteering. They're volunteering to serve our community. So it's tough, and I think everybody should have a choice, but we really should put together the best qualified committees if possible. And unfortunately, I wasn't there for the interviews to know these candidates at all, so it leaves us in a very difficult situation. But I certainly think that that Mr. Holcomb is extremely qualified for the position. So again, it leaves us in a very, very difficult situation because we don't have the knowledge that Peter has, unfortunately, with having interviewed all these candidates.
Okay.
So, and I just don't want to take one person out. I think it should be a bigger conversation of what we're trying to achieve overall than these particular candidates.
So you're suggesting, Selectman Post, that we vote on we entertain a motion to approve both?
Well, I'm just saying it's hard to, I mean, I don't think when we get to the next one, Mr. Stone's comments are going to be any different. So perhaps maybe a little bit of background of what we're trying to achieve with the committee, so we can better understand why Peter feels these are more qualified than Mr. Holcomb would be helpful. But again, we weren't there, and I hate to do this to these volunteers that, you know, that are interested in serving the community.
Mm-hmm.
Mr. Chairman, if I
Yes,
could.
Selectman Stone.
I'm not speaking against these other people. I want to make it clear, I don't know them. And that's one of the unfortunate thing about appointments. I would say the vast majority of people that come before this board for appointment, I don't know. But I do know Mr. Holcomb.
Mm-hmm.
And I think he'd be a tremendous asset in guiding this committee to putting together some developed financial plans for the capital improvements of the golf course. I think he has all the qualifications to do that. And I think we'll be missing a real opportunity here to have some professional guidance from somebody who is very experienced, educated, and skilled in finance. I don't know why we're letting him get away, really.
Can I ask Peter a question, Mark?
Go right ahead.
Do we know if there's more than 2 positions open or any alternate positions where we can accommodate all of the volunteers?
Mr. Donovan is going to be put up as an alternate, and next week there's going to be some more people put up as alternates for the golf committee.
So would you consider appointing Norm and appointing these 2 as alternates?
No, I would not.
Wow, that was a pretty solid no. So there seems to be something behind this. Okay, that's what I.
One of the questions I have, sometimes when I served as chairman of the appointments committee, the golf committee would always be interested in having some members participate in the interviews. Was that part of this process as well? Were members of the golf committee involved in any way in these interviews? Who sat in on these?
The chair sat in, Alan Chapman sat in.
Okay.
On each of the.
Each one of them.
Each of the.
So this is a recommendation that comes both from you, but with the support of the leadership of the golf committee.
Correct.
Okay, that's
So
helpful.
was there a scoring done?
We did not do a formal scoring, no.
Yeah, but that's been a pattern that is not unusual. It's oftentimes when the individuals come before the appointments chair and usually the chair of the other committee that's involved, that's being appointed to, that there's usually a very thorough, very pointed interview process in a number of areas are covered. It's difficult sometimes to score because if you actually look at the scoring criteria on the sheet.
Oh, I did it for years. Yeah.
Yeah. So
We used it in every appointment for this reason. And, I'm a little bit concerned with Peter's response to some consideration of Mr. Holcomb. It seemed obviously that there's something personal there. So that's a concern to me if it's because of a disagreement.
I would argue with your statement that there's something personal. I don't know what that's based upon.
It was based upon when I asked you
Right.
if you would consider it and you said no. That was your response. That's what it's based on.
I would say no, and I would say no again. It was a recommendation by the golf chairman and myself that we felt that these people were better to be able to put together a committee that would get along and get things done.
Thank you. Selectman Horgan, is there any questions that you might have on this?
Well, first off, I was not aware of any email from Mr. Holcomb, so this catches me a little off guard.
Okay.
I was not copied on that email. I'm aware of Mr. Holcomb and his qualifications. I'm also aware of some of the challenges that Mr. Holcomb brings to participation. And there's a certain level of deference that I accord to the appointments chairman and the process that he went through with the golf chair. I agree. Mr. Holcomb has very good qualifications, but we only have two positions that are on the table for tonight. I think what I'd like to suggest is that we move forward with the appointments for tonight and ask the appointments chair to reconsider Mr. Holcomb's application for future appointments that might be in order or suggested.
Anybody else wishing to be heard?
Well, that's exactly what I had asked him to do, and he said no, so.
Would you care to speak again on this point, or is my?
I believe what Dan said was what I consider Mr. Holcomb for a different position than the golf committee. Sure. Would I consider him for the golf committee? No. And again, I was not copied on that email either, so I had no idea exactly what it was.
Okay.
I did have a conversation with Mr. Holcomb on the phone when I did tell him that he was not going to be recommended.
The email went to the general selectmen's box, and then it was individually copied to Mark, myself, and Tracy.
Yeah, so everybody should have seen them.
Well, it was individually to Mark and Tracy and
myself.
That would not include myself and Dan.
Not individually, but it did go to the selectmen at yarmouth.ma.us, which should have reached all of us.
Irrespective, I did not get the email.
I hear you. I understand. Anybody else? I mean, at this point, we have one applicant, Doreen Levitan, for a 3-year unexpired term through April 2024. She's the candidate that has been presented us for action. Let me ask if there's a motion.
I actually made the motion.
You made the motion. Okay. Did it get seconded?
I seconded it, but I'm going to withdraw my second.
Okay. So is there another second?
Second.
Okay. So we have this motion on the table. Is there any more discussion about Ms. Levitan? All right. All those in favor say aye.
Aye.
Aye. Those opposed?
No.
Nay, and this is not a reflection of Ms. Levitan, for the record.
I understand. So
Yeah, I am not voting against Ms. Levitan either. I just think Mr. Holcomb should have been the appointment.
I understand. The next in candidate, so you've got the vote on that, right? It's 3-2 in support of Doreen Levitan. The next candidate is Richard Donovan. Is there a motion to support Mr. Donovan for the alternate position, a 1-year unexpired term through April 2022? Is that
I'd make that motion, Mr. Chair.
okay?
Second.
And we have a motion and a second. And discussion. Hearing none, all those in favor say aye.
Aye.
Those opposed?
Nay.
Okay, we have a nay. All right.
Again, it's not a reflection of Mr. Donovan. I just think we should be more inclusive in our consideration.
Next item. We have in front of us Cindy Eckert. We did not act on this, did we, Mr.
We're
Chairman?
not acted on this one yet.
Okay,
This
the recommendation is to appoint Ms. Ecker as an alternate member to the Old Kings Highway Committee for a 1-year term. Is there a motion?
I'd make that motion, Mr.
Is there a second?
Second.
Motion and a second. Any discussion? Hearing none. All those in favor say aye.
Aye.
Aye. Opposed? Any opposed? Carries unanimously. All right. Are there any other?
For the resignation as well, I think.
Yeah, if you don't mind, could I speak to this?
Yes.
Mr. Appointments Committee Chairman. We as a board received an email just recently from an individual named Tom Barron. And Tom has informed us that he's stepping down from a number of assignments. And I just want to note for everyone for those that are watching and paying attention, Tom has just provided yeoman service to the town. He's been a fixture here, incredibly talented, an outstanding background in engineering and a whole host of other things. And I'm just saddened by this, that he's informed us that his health is declining and that he has to leave these assignments. And we're going to miss him. And I would like to make a motion that we accept his resignation with immense gratitude and appreciation.
Second.
Second.
So moved.
Okay, any discussion? Hearing none. All those in favor say aye.
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 Carries unanimously. Is there any other business, Mr. Smith?
No.
Okay, very good. The next item on our agenda is approval of minutes, August 11th, 2020.
How about the agents of the licensing authority?
What is that?
That's usually in our consent agenda.
That's usually a consent agenda item.
Okay.
Was it posted there or
Well,
no?
it was under. my
Okay,
agenda
well
under
then
the
let's
appointments, but I wanted to make sure we
let's
didn't-
just take this up. So the board has before it from a memo from the Yarmouth Police Department, a list appointments, agents of the local licensing authority. These are the people, and correct me if I'm wrong, Selectman Stone, but these are the agents of us as a board, as a licensing authority, to actually intervene or do business in serving our responsibilities as the licensing authority for the town. Is that correct?
There's certain things that a licensed business cannot do. They cannot, for example, refuse to let the licensing agents come into their business and things like that. So by appointing them as agents, they would have the same powers as we would in a situation where they were, for example, trying to gain access to a business. If they refused them, they would have the same consequences as if one of us was refused.
So this
I
was
make a motion that we approve the appointments as presented.
Okay, do I have a second?
Second.
Okay, motion and a second. Any discussion?
Yes, I'd like to hear what Mr. Stone has to say about it. Are we giving these folks powers that they may not, should have?
No, I don't think we're giving them powers that we shouldn't have because we can't go out there and run around and do all these things with these various businesses.
So when they,
A lot of people think that if a police officer comes to a business and says, I want to inspect this or I want to inspect that, they can say no. And they could if they weren't agents of the selectmen. But by giving them status as agents from the selectmen, they can't, if they do turn them away or don't cooperate, it would be a violation of their license and action could be taken against them. So it really extends your powers and authority out there to these people to work on your behalf.
Is this
That help?
something that we're doing new? or-
No,
this is-
we
this is-
do it periodically.
We do it every year.
every year, yes, exactly. So, okay, we all set? So we've got a motion and a second, and any more discussion? Hearing none. All those in favor say aye. Aye.
Aye.
Opposed? Carries unanimously. So now let's get back to, anything else, Bob, I may have missed? Okay, good. So we have before us, let's just go right first to the August 11th, 2020 minutes. And,
I move the minutes of August 2020,
Second.
okay, motion and a second.
August
All-
11th.
Those who say aye. Aye.
Aye.
We have one abstention and
Two
two abstentions. We have an abstention from Selectman Horgan and Selectman Smith. I have to remember the people that are transcribing our minutes are actually listening to the discussion, so I need to make that clear. All right, we have the minutes for the 16th of November, 2021. Do I have a motion?
Move the minutes for
Second.
second.
We have a motion and a second. Any discussion? Hearing none. All those in favor say aye.
Aye.
Opposed? Carries unanimously. The next item on our agenda is upcoming agenda review. So we're looking ahead to the 14th. And we're looking at, anybody have any comments or thoughts, additions? We obviously have a COVID-19 discussion
I
on the
think we
agenda.
also talked about having preliminary discussion on the legal counsel search.
Yep, it's right there. You see it?
I'm sorry, where is it?
Next to last item on the agenda.
I don't see the music room on here.
Music room hearing
Yes,
is not
That's-
listed and it should be good.
yes, good catch. Anything else we're missing? Sounds good enough. So this will be our last meeting as the board before the Christmas holiday.
I have a question. How many of those, did you say three law firms we're gonna narrow it down to?
Yeah, we're going to narrow it down to 3.
So if we want to consider our existing firm, does
That's
that
part of
count
your-
as one?
Yeah,
Is
that
part
counts as one of the 3, yes.
Okay.
Yes, I picked my 3.
Right.
All right, so we'll have that on the agenda. Anything else? Any other potential agenda items we should put in the box on the bottom?
Last week, I thought we delayed a report on the water.
We did.
Department's quality.
So we want to bring that back up. I think that's a smart move. Anybody object to that? Put that on the list.
What was that?
That was the, we had some reports regarding contamination regarding water supplies.
The wells?
And
The well
yes,
closures?
yes. And there was some issue, there may have been some issue with the test results and the methodology. So that was being looked at and examined. So what we learned was that there may or may not be an issue. So that was going to be double checked.
I think there were 2 wells.
Yes, and there were high levels of nitrates. So let's put that up for, without a date, but we'll put that back in the box. I know we've talked before about the Tourism Promotion Fund. Those grant applications are going to be done probably in December. They have to be submitted, so probably sometime in January or February, we'll hear about that. So we can add that list.
One other thing that came up in actually the Affordable Housing Trust was the town's applications and the policy, or the kind of, it's not really a written policy of the board, that we've always reviewed them prior to them being submitted. And I think that that's a worthy time investment for us before they go too far down the road. I'm not sure where we're at, but I'm not sure Mr. Whitner was aware of what our requests had been in the past.
What is that again that we would review?
Town-sponsored applications for CPA.
Oh, okay.
At some point in time, I'm not sure what the deadline is for the CPA applications, but because some things had went way far down the road in past years, without even us knowing, we had kind of made a policy that we kind of get an overview of what the town was going to be requesting before it was requested.
Yep. Yep. That's a good idea. We did that, yes, before.
Mr. Chairman, the
Yes.
CIP has concluded, so that's available to be submitted to the board.
Okay.
The Capital Improvements Plan.
So that's a future agenda item. Any others?
We asked the golf folks to come back with numbers. and
That's right, golf fees.
I actually thought they were going to be on the 14th agenda, or if we're to book for that, early in January.
I think we're waiting on when they're going to be ready. Mr. Scott, can you tell us, since I think you're intimately involved in the preparations?
I'll be meeting with the director this week to go through the material he has.
Okay, so there's maybe potential for the 14th?
Potentially. Yes.
Potential. Yeah, it's what we call a work in progress. Is that a fair way to characterize it?
Yes, we want to see a report before putting it on the agenda and hoping for the report. Just
Right.
to make sure that your needs are.
Right. Just so the board knows, in full disclosure, I've asked that rather than us all see what they have the night of the meeting, that the material be prepared and vetted by the administrator and the assistant administrator, so that when it does show up on the agenda, everything that we've been looking for will be part of the presentation. Because I don't think we want another repeat.
No, absolutely.
Okay. Is that a fair way to characterize it without being too blunt? Okay, good. So that's it for, unless there are any other upcoming agenda items, let's move on. The next item is individual items. Selectman Horgan, do you have an individual item?
I do not. Thank you.
Selectman Stone?
No.
Selectman Post?
No, the only one that I had messaged you about having a discussion on was the radioactive discharge into the bay that seemed to have been corrected in today's newspaper. I was concerned about that yesterday when I read it, and I thought that we should write our legislators. I still think to some extent we should write our legislators, because the fact that that's even an option, it mind boggles me. But for now, apparently they have chosen not to do that, which is I'm happy about.
Yeah. For the board's benefit, this is the story that was in the front page of the Cape Cod Times regarding the discharge of radioactive water into Cape Cod Bay. Is the board comfortable maybe with writing a letter, after the first of the year, something, getting on record with our legislators, urging them to prevent it from happening, period?
Ever. So Selectman
Post, do you want to take a first stab at a draft letter?
Yeah, I'd be happy to. I think that I think it's important. I know, comes down to money with these, with the operators of these plants. And there are alternatives, just like we deal with NSTAR. The operator of the plant had originally requested a cheaper way, which was discharging radioactive waters into the bay, which they've put off for now. But I'm confident that it will probably come back up again. And I think that we should go on the record so that this option is taken off the table.
I think with the lack of regulation and oversight of the nuclear power industry, I think it's almost guaranteed. So I appreciate your interest in drafting a letter for the board. That'd be great.
Right, Ms. Post, that would be to both our state legislatures and
Federal.
Washington.
I agree.
Yeah. But it's principally a federal issue.
Yep.
All right. So
Well, they
that's-
should be, I think that they should be made aware and they should be advocating for us as well.
Well, I think obviously Representative Keating and Senator Markey have been prominently noted in the story. So obviously they have been very aggressive and advocating on our behalf. Town administrator items. Let's move on to that agenda item, consent agenda.
Okay, Mr. Chairman, for the consent agenda, there are two items. There are the request for the approval of the commercial shellfish regulation changes effective Saturday, January 1, 2022, and the residential shellfish regulation changes effective Sunday, January 2, 2022. And in addition, there's the approval for the Solarize Yarmouth team to use the Yarmouth Senior Center this Thursday, 6 to 9 for a town-sponsored activity, which I hope it's approved. So you were all invited this evening. I wouldn't want to have to send some agents of the licensing authority out to speak with you.
All right. Do I have a motion to approve the consent agenda?
Motion. Second.
Okay, a motion, the second. Any discussion? Hearing none. All those in favor say aye. Aye. Opposed? Carries. Town administrator updates. Status of the Blue Sky Cell Tower project. and upcoming hearing.
I want to acknowledge our town planner, Kathy Williams, who sent out a very nice update to the board that includes, some graphical information as well as potential letters that have been submitted. And I think
Did everybody get that?
I hope everyone
I haven't seen a thing.
received.
Anybody else?
It's not in the packet.
It was
Here,
not
Pat,
in the packet,
we
but
can-
it
we
wasn't
can-
an email that I got.
When did you get the email?
I haven't had access until today. So
We got the email on Friday. So it was after the packet. We got the idea of doing a packet when we finalized the agenda. But after that, we had to work and develop the packet. So it wasn't ready till late on Friday. And I sent it out to everyone. And I'd like to maybe at least send it around so you can look at it. There's a couple of issues that I just wanted to mention about the Blue Sky Cell Tower. It is a development of regional impact. So it trips the threshold criteria by virtue of its height.
Did you do me a favor, Bob, and send it to me again? It never showed up for some reason.
I absolutely will
I'm
send
sure
it
you
out
sent
to
it,
everyone.
but for whatever, all of my Yarmouth emails, there's always an asterisk because
Yeah, that's a shame.
because I don't always, it's like the same thing, you see something to all the selectmen and some members get it and some members don't. But I'm sorry, please proceed.
So it's in front of the Cape Cod Commission for a public hearing. Now, unfortunately, the public hearing is scheduled for next Tuesday, the 14th at 5 p.m., where, we'll be just probably getting ready to go into the Board of Selectmen's meeting. And in meeting, I know that the planning board has submitted comments to the Cape Cod Commission on this. And the town planner, I've talked to, she had a very, very nice packet. So that goes out to the Board of Selectmen. And the question is whether the Board of Selectmen is potentially interested in making some comments as well. And I would say based on the plans, based on the renditions of it, there are three basic concerns that we have with that proposal internally and through the planning board. The issue of having the cell towers and the communication is essentially a positive feature to our technological landscape. The concerns are with the location, which is right out practically on Route 28 in, one of the most visible locations in town. The height of the facility is, in excess of 100 feet, far higher than similar towers, that have been built in the area. And thirdly, the aesthetics of the tower make absolutely no effort to hide, the fact that it is a tower. In fact, it's probably designed as one of the most poorest looking towers that I've seen, and examples right across the street. The Verizon Tower, they use the type of aesthetic design that hides the fact that it's a tower, yet they still provide great service for Verizon. And this tower is geared towards the other services that don't have as good of coverage, but those issues of location, height, and aesthetics are the ones that the town is trying to really push forward on the commission to take into account in acting on the DRI. So that's basically that issue.
So I asked the town administrator to put this on the agenda because the board itself may want to weigh in and echo the same concerns that have been expressed by the planning board and other staff. In fact, I think our representative, Jack McCormick, who served on the Cape Cod Commission, was very outspoken and critical of the project. I've read his comments. So the tenor of at least the commentary about this project from town officials has been very, very critical of it. So is it the will of the board maybe to approve at our next meeting a letter that sort of reflects the positions of some of the other boards and leave it to maybe the planner and the town administrator to draft for the letter for us to review at our next meeting?
That would be great.
Does that sound good?
Yes.
Okay. There you go. So we can move forward on that. Thanks, Bob, for putting that together for us.
We'll work on that. And just a couple of other items I want to make the board aware of. I haven't received this presentation electronically, just in a paper copy of it, but I attended a meeting last week on December 2 with the Cape Cod Hospital director and staff regarding their revised proposal, which they're making public for a new cancer and cardiology expansion facility on the campus of the hospital that is very, very close to the Yarmouth border. And this will be, again, in front of the Cape Cod Commission. It is roughly half the size of their original proposal, which they withdrew. And it is they have a new architectural firm. It's designed much differently. And what I'd like to do is follow up, make sure board members get a copy of the renderings, the new proposal, and any information that we're able to gain on this project. We'll forward along to board members so that when this does come to be a DRI, it'll be one of the biggest projects on the Cape. And I just want everyone to be in the loop to know that they're starting the process to invite local officials to see the plans, and the next logical steps will be when they're prepared, probably right after the first of the years, to submit this. But it's substantially changed from their initial proposal. And so we'll follow up with more of this information. If you want to take a look at some of the slides, you can take a look at those. And I just want to also make board members aware, we are hip deep in our budget process right now. I really want to acknowledge Bill Scott, who's done yeoman's work with the Capital Improvement Program Committee, that they have a series of recommendations that will be presented to the Finance Committee and the Board of Selectmen, I believe, this week. And tomorrow we have a meeting of the Finance Committee. We're going to talk about CIP. We're going to talk about budget. Over the next 2 weeks, I will be meeting with every single department to review budget requests in a very high level of detail. And the Board of Selectmen can expect to see a draft recommended budget by the end of December. And that's going to be one of our major activities of the department. And that's about all I have for this evening.
Any questions for the town administrator on his report? Seeing none, let's move on to the next agenda item, which is that thing we call adjourn.
Motion to adjourn.
Do I have a second?
Second.
Okay. I have a motion and a second. All those in favor say aye.
Aye.
Aye. Opposed? Carries unanimously. All right. Meeting is adjourned. Thanks, everybody. And
Thank you.